thank you for coming today. The first question is, your Stillwater Medical Center has extensively renovated over the last 5 years. What are some of the key changes that were made, and why did these renovations occur?
Well, I've been here 18 years, and we've been in a continual state of renovation and upgrade just because it's necessary to meet the needs of our medical staff and being able to provide for the technology. We expanded our ER because it was out of date, and in fact we just even expanded the waiting room, adjusted the front door so the wind doesn't blow, north wind doesn't blow right straight through the door. And so we just did that. But our third floor is undergoing a major renovation and allows us to have the computer in the room and a headboard that has all the medical and electrical outlets that we need. We needed more emergency generator outlets. We didn't have those, and so you have a major power outage and the generator comes on, but you don't have anything to plug it into. So in addition, it's going to look very nice, and the nursing stations got more computers for our physicians, and so you just have to keep renovating, or you get behind. And we've been fortunate with the support we have in Stillwater. We've had the financial resources to do that and continue to grow and add the services that we can.
Okay, and you talked about growth. You guys are growing again on with a new campus that's southwest of 12th Street.
Our South Campus, as we call it, is exciting, and as the dirt work went on, people will comment that's the biggest dirt work project we've ever seen in Stillwater. They went in and there were 50 acres and 30 was in the floodplain, and 24 are now above floodplain and ready to be developed. I will tell you, it's a once-in-a-lifetime opportunity for a hospital like ours. I've told colleagues of mine who are hospital administrators that, I just finished getting 24 acres ready to be built on 6 blocks from my hospital. And they go, "You're kidding. That's impossible. You can't." Well, we just were fortunate it was there. So it is ready, and we are going to, a couple things we're not going to do. We're not going to build a new hospital there, and we're not going to move my office there, and we're not going to build a par 3 golf course. But we are going to build a support services building that will consolidate a lot of the services we have off campus. We've had to rent offices because we don't have enough room. We have a business office, physician practice management and billing all downtown. Accounting is off campus. Home health is in a rental building. And so we'll put all those in that one building. And now we've even tweaked that a bit to think that we probably ought to put some medical office space in it as well. So we're designing that building, and that's the first thing we will probably build. And durable medical equipment, Cimarron Health Supply, is all the way on East 6th Street behind the John Deere place, and so we'll move it on campus. The main thing is that for 20 years we will have a place to provide medical services, to grow and add things that we need to. And so it gives us so many possibilities, and it was such a fortuitous opportunity, quite frankly. We were looking at a little piece of land down there for something. I don't remember what it was, and then someone said, "Well, what about the whole section?" And we said, "Well, okay, that's what we did." So,
and talk about your green commitment out there as well. I know that there's going to be a walking track, and you guys are trying to keep some of the trees as well.
Yeah, that's exciting. If you look at the campus from 12th Street, you'll see that a row of trees in the back that we kept. That's really the kind of the dividing line between the front property that's developable and then the 30 acres behind it that's in the floodplain. Well, we're going to put a walking trail all the way around the campus, all the way to the back of the property, around the floodplain area, to the creek, around and back. That's exciting. We can also, in those trees that we kept, we can put a little park area. And then we've always stated that we would look for an opportunity to use that land that's in the floodplain. You can't build on it, but it would be ideal to put ball fields in. And there is a group in Stillwater looking, in fact, the mayor is a part of that, looking at quality of life issues. And one of those is a group of ball fields that might be softball, baseball, soccer, that you could put in that area. And our board, we're going to discuss that next Tuesday, but I feel like we've already somewhat addressed it. We'll more formally ask them, now, is this okay? But to proceed with developing a plan that would put ball fields there and allow the city, or really maybe the athletic associations, to use that. There's also property to the next, to adjacent to it, to the east, that C-Star owns, Howard Offlegger, that is really contiguous to our property, that's in the floodplain, that he's offered to let use for ball fields as well. So conceivably, you could have ball fields on our property, you could have a walking trail around it, you could have a bridge over the pedestrian bridge over the creek and into his property, where more ball fields are, and connect all that to Babcock Park. So that would be exciting and a really neat project, and so we'll see how that develops.
Sounds good. The hospital is one of Stillwater's largest employers, and the hospital employees seem to be very involved in the community. Do you think that is one of the reasons that the hospital was selected by the Stillwater Chamber of Commerce as its large industry of the year?
I think so. We always are signing up for the Heart Walk or for helping with the joint jog or United Way, where we exceed our goal every year for the United Way campaign, and our employees are wonderful about giving back to the community, and whether it's cancer, heart, MDA, you name it, they're Big Brothers, Big Sisters, Wings of Hope, they're involved in it. And so we're happy to support that. We're happy to give back to the community, and yes, I think that was a big part of it. I think the 12th Street project was part of it. The renovation, the addition of services, I think probably all that was a part of being the big business of the year. So we're very proud of that.
Okay. The hospital recently purchased some robotic surgery equipment. How will that help the hospital and its patients, and how is technology changing medicine?
Well, the robot itself, it enables a surgeon to, when he's working, it is being used on urology, OB/GYN, and general surgery at the moment. And so it allows for more precise cutting and work in the human body. It has less blood loss. The patient recovery time is quicker. And it's something that the public is beginning to expect. I think the jury's still out as far as the long-term outcomes, but what struck home to us, the need, was we have a urologist in town that is retiring, and so we're recruiting a new urologist, and so we're talking to him. He's a great candidate. He's interested. What we found out, though, was that the only prostate surgery he had ever done was on a robot. I mean, he wasn't prepared to do it any other way. And so you're thinking, wow, if you don't have the technology, you won't get the young docs, you won't get the replacement physicians for your medical staff and for your community. And so that really drove it home. That's what, I made the comment that for a couple of years now I've heard this robot clanking up the interstate towards our hospital as kind of a metaphor, but then I realized, wow, it's already here. And so we have it. We have 3 physicians now credentialed, and we'll have a total of probably 9 before it's over with. And it's a great service for our hospital, and But if you can't keep up with the technology, you won't be able to recruit the physicians. And our community wants to have a urologist and a GI physician, a neurologist. We're recruiting one now for Stillwater Medical Center. They want it in the community. They don't have to travel to Oklahoma City. And so we, to the best of our ability, try and provide that.
And finally, the Affordable Health Care Act is coming. What impact is that going to have on us as Stillwater Medical Center and the medical community?
Well, some of the provisions are already in place. It made us change our health plan like it did everyone else. We now include people on our health plan, children up to 26 years of age, and all that's fine. There are provider cuts. There are reimbursement cuts to us, and it'll be about I think $1.2 million. It's in the sequester thing, and so it'll probably start about March 1st, and that's an annual cut. But all providers are going to have to do their share. Everyone's going to have to do their share. Someone will have to pay more. Somebody will have to get reimbursed less because we're in that predicament. If we didn't have the Obamacare or the Affordable Care Act, then they would still be cutting the budget, and our reimbursement will still be cut. We just need to do our share and be thinking about how to prepare ourselves to do a little more with less. And so we've done that. We're working on that, and we don't think it's a threat to us. It can be, and probably will be, a threat to some of the really small hospitals around Oklahoma. We think we're well established and have the resources to do well under whatever the Affordable Care Act or other changes come our way.